Hi, good morning, everyone. Thank you for joining us here today. Jeff Babe. I am currently the HIMSS Michigan Chapter President-elect for the 2027 fiscal year. And glad you could join us for this webinar with Art Nicholas and Helen Hill today. Art Nicholas will be your moderator. Art's currently our Michigan Chapter Secretary for HIMSS Michigan and Chief Growth Officer for Interlace Health. And Helen Hill, someone who needs no introduction and whose accolades are too numerous to mention, but currently an executive board member, chapter founder, and past president of the HIMSS Michigan Chapter, executive board member of MIHIN, and a principal with the Kieran Consulting Group. We're honored to have you both here today. So Art, with that, I'd like to hand it over to you to kick things off.
Great, Jeff. And I just want to mention before we get started, if you have questions, we're going to try and address those towards the end of the session. If you could just put them in the chat, that would be terrific. So you see three smiling faces today because on top of the fact that we're all members of the Michigan HIMSS chapter, you've got three people that are very proud alums of the University of Michigan. Helen and I are very passionate sports fans and have spent a good portion of this basketball season, both men's and women's, texting each other before, during, and after games, which has been a lot of fun. But on that note, Helen, why don't you share with us some of your experiences when you were a student at the University of Michigan to get us started?
Sure. Thank you, Art. Thanks, Jeff. And thanks to all of you who joined us this morning. I've had a really long career. So I was at the University of Michigan in the mid 60s. And, it was a very different time. There weren't any women's sports. The club sports were dying. But it was a wonderful university. And and it gave me many opportunities. It was a time, too, when women had a hard time getting real jobs as part-time jobs or full-time jobs. So at the university, I lived in a co-op at Henderson House. It was an alumni-owned, excuse me, it was funded by the Alumni Council of the Alumni Association and had been in existence since 1945, but it was a place where I could save a lot of money. It was about a third the cost of the dorms, which made it quite affordable. But I also had, in those days, we did things like babysit for professors. And I babysat for the children, the four children of the associate director of the computing center, Dr. Bernie Galler, who was really famous in computing. And I was also working at the Bureau of Government Library in the basement of the Rackham building. So I was kind of busy. But Dr. Galler told me that I should consider doing something at the computing center. And I said, I don't have that background. And he said, no, we'll start you out in operations. Go see Mitch and you'll get a job.
So that's great. That's terrific.
So for $2.50 an hour, I worked at the U of M Computing Center with a bunch of genius engineers, and I loaded cards, punch cards into a Mod 20 for grad students, including the Unabomber Ted Kaczynski, who was a grad student there. But it gave me a start. And then when I graduated, the university made an offer to me to join a pilot program of 5 people to learn to be a computer systems analyst. And I see Bernie's hand in that. So, I have great thanks to him for getting me a great start in my career. We had a woman from IBM's Ed Center whose husband was on a sabbatical at Michigan, and she was from Toronto, and she was bored to death. So she took over educating us all. It was before IBM stopped funding, or it was when IBM allowed you to do anything, education, systems, et cetera. So it was a great opportunity. And we learned major computer languages and how to be systems analysts. And so I went on, worked there for a couple of years, and then moved on. But U of M has been great for me, and I've tried to give back. At one point, I joined a group called um, great M Women, which funded women's sports to some extent. It was at a point where their coaches got paid, but their assistants didn't. And if there were anorexic kids and needed treatment, they couldn't go to the coaches. So we would fund things like that and, kickstart electronic scoreboards and things like that. So
Yeah.
I'm still the treasurer of that. And years later, I went back to become the chair of the board of Henderson House, the co-op where I lived, where there are 28 women. And we have great students. One of them just got her PhD in biochemistry and was one of two speakers at the December convention commencement. So
Yeah,
it's great.
That's great, and that's a common theme, I think, Helen, throughout your career. I think you gave back after people helped you out, and you started to cover one of the things I wanted to talk about next, which is professional life after graduating from Michigan. Could you tell us specifically how you got into healthcare IT, the roles and organizations that maybe impacted and drove you into that part of your career?
Sure. Well, as I said, I've now been trained in uh, how to run.
Helen, I don't know if you moved. I think we're losing
Oops.
sound wise a little bit.
Sorry, do you have me?
Yep, now we do. Yep.
Okay, great. Well, while I was at U of M working as a systems analyst, I got a call from St. Joe's in Ann Arbor, and they wanted me to come out for an interview to be a systems analyst there. So I thought, well, I'll go check it out. And I got a call back that afternoon offering me the job. And I thought, wow, that was fast. And my first day there, they took me to a board meeting. And I thought, wow, they have high visibility. Well, it turned out the provincial administrative team of five sisters had given IT an edict to hire its
Hmm.
first woman. So I was the first woman. And this was both a disadvantage and an advantage. The guys weren't sure they wanted to work with me, so the director sent me out to develop relationships with all of the directors at St. Joe's and clinical administrative, upper administration, business operations, and see what I could figure out to do for them. And so in a way, I became their consultant as I was also developing programs for them because in those days you really couldn't buy anything other than a paper tape lab system or a basic accounting system. So if you wanted something, you had to develop it. And the leaders of these departments helped me uh, pull together teams of their people and our people to develop computer systems. So nurse staffing and scheduling, pharmacy unit dose system, one of the first that actually had codes and a schema. And we were one of two hospitals to pilot that for the American Society of Hospital Pharmacists, and on and on. There were a whole bunch of things, and for many years, we had to do all of our own development. And then finally, there was some investment by large vendors and some interest in ancillary systems. So people
Hmm.
began to go out and look for them, and they came to me to help them. And the nursing administrators kind of adopted me, and they had me take them to a session by now famous professor, Marion Ball, on computers and nursing in Washington, D.C. And we kind of went from there. So they'd take me to
That's
their conventions. I publish papers with them and speak to groups. And the sisters themselves were very helpful. There was a Michigan Men in Management group, but nothing for the women. So we went to a couple of the women administrators and to the sisters and said, could we do something? And we wound up with I think, $30,000 grant, which was big money then, to develop a women in management organization across the entire Mercy hospital system. So by that time, they had, had developed relationships with more and more hospitals, and it was becoming what's now Trinity. So
Yep.
I was there when they built the then new hospital 50 years ago, but it was important because I was on the ground floor of, what does it take to put systems in, heating, cooling, all the, what computer systems do we need to support the physician group, things of that nature. Great opportunities there.
That's amazing. That's
Yeah.
absolutely amazing. So, you said they took you under their wing. I think they were smart enough to realize what a tremendous asset you were going to be for them and the organization. So, Helen, your modesty is once again coming through. Continuing along the line of healthcare IT and information and infrastructure, talk about how you were involved with establishing and growing the health information exchange infrastructure here in Michigan. And then I might have a follow-on question if you could maybe explain also what that is, because not everybody on this session is probably as familiar with the health exchange in Michigan as maybe some of the rest of us are.
Sure. So I should preface this by saying after St. Joe's, I went on to national computing firms, and I was a subject matter expert and a process engineering person, and did all kinds of things and got involved in health informatics and standards and HIMSS. And I went to my first HIMSS conference in 1985 in Denver when I was still at St. Joe's, and began to meet people from all over the world. And it gave me connections that I was able to use later on. So by the time, hospitals were working on CHINs, community health information networks, in the 90s and leading up to 2000. But they weren't really moving, and they were somewhat isolated. And there was a movement both to get standards established for data established across the country, and also to do a better job, to begin to put in place the framework that would be needed, both governmental and in the states, and technically, to exchange data safely and effectively to improve patient access, quality, all of the things that we try to do today. So there were a lot of, so I had by this time started the HIMSS chapter, and we got a lot of people together, and the governor decided that Governor Granholm, that health information exchange would be a great thing. Her CIO, Terry Takai, was instrumental in this, and they set up grants for HIEs in the state. It's kind of a long development process. But before this, there were maybe 300 people involved in the very first session in Lansing about what we could do to improve exchange of data, something that we then called that we started to call health information exchange. And this was happening nationally as well. And President Bush in 2004 had announced, that computers would need to connect, and
Right.
that we would need national networks. And because I was involved in HIMSS at the national level, I was also involved in some of that stuff. But here in Michigan, we put together a roadmap for connecting health in Michigan. And there were 4 or 5 major committees of people, and I was in one of them. And we came up with this. We published a 5-year roadmap, Conduit to Care, that has later morphed into the current Health IT roadmap overseen by the HIT Commission, the Health IT Commission in the state. But I then became part of the small group of people who volunteered to lead health information exchanges in nine what they then called trading areas of the state. And we had a coordinator that the state paid for from Michigan State, and she got us all together, and the hospital association, and the auto makers were part of this, and banks, and it was a really big cross state community effort. And we decided that we would create something called the Southeast Michigan Health Information Exchange and apply for one of the $10,000 grants that was out there to get it going, and put together this fairly sizable community effort. And I wound up being the first president. And then later, Dr. Rob Jackson became the president, but I stayed on as one of the leaders. And we participated in getting SEMHI going, and figuring out what kind of software we'd either have to buy or develop. And at that point, it was pretty much developed. Like the early days when I was at St. Joe's, you couldn't buy much. Today, there are lots of vendors in the space, and people have advanced, but not then. So some of this stuff was like a science project. And the ONC we helped to codify the Office of the National Coordinator through HIMSS Global and other partners. But, we did a lot of advocacy in DC to get that codified and get funding for it. And in 2010, in 2009, they had something called the Standards and Interoperability projects. And we had a demonstration project that took us to some national audiences. How do you exchange things, and how do you protect it? And then in 2010, the Office of the National Coordinator announced cooperative agreements for the states. And I was on a small group of people who worked on that response and got the grants for us, and was in the group that put together the structure that became MIHIN, the Michigan Health Information Networks, statewide health information exchange. And I was appointed by the governor to be on the first board, and I'm still on the MIHIN board. And I also chair their Interoperability Institute, which is a subsidiary. But yeah, it's been a long road. We've worked very hard. What else would you like me to explain to people?
Yeah, so I had one other question. So you alluded to the fact that you had to build a lot of things. Was that a surprise, and is that the thing that turned out to be harder, or was there something else, whether it was different players cooperating? I mean, what surprised you in that journey with HIEs that was harder than what you expected when you started the journey?
Everything had to be built. The standards, there were competing standards. We needed national bodies to work on, on coordinating the standards, both syntactic and semantic. And Um, so a lot of us put volunteer time. You know, thousands of people across the country got involved, and it was really pretty amazing to see that work go, but it was so slow. I mean, it's really a lot of this has been like watching tectonic plates move.
That's healthcare IT, right? Or healthcare in general, unfortunately.
Yeah, for health health IT was underfunded
Hmm.
forever.
Yep.
It was really about the lowest of all sectors of the economy, less than 1% of either revenue or budget, no matter what figure you used, was invested up
Yeah.
until the dot-com bubble and year 2000 when people decided, oops, we've got to put money in. And then people saw opportunity. But it's a complex industry. If you've seen one, you've seen one, and that's part of
Right.
the issue.
Yeah. That's
But we've
great.
made tremendous progress,
That's,
actually.
yeah, that's fantastic. It's a great history, and we benefit, all of us, both as patients and as members of this industry, from the time and investment and volunteering that you and others did to get us to this point. Helen, you mentioned, and this is a topic near
Mhm.
and dear to this audience. You mentioned a couple minutes ago about you founded the Michigan chapter of HIMSS during this process, or as
Mhm.
part of the thing that got you engaged. So what was it? What was the gap that you recognized, or what was the impetus for you to say, "Hey, we need this here, and we need this now, and I'm going to help get this off the ground"? What
Well,
was it an aha moment, or were you recruited to do this? Help us
yeah.
understand how you got this wonderful chapter off the ground.
So there had been a chapter in Michigan I think, starting in 1985. And Bill Schramm, who was vice president for management engineering at Henry Ford, and his group of management engineers were leaders in starting it. In about 1987, they had a meeting in the Detroit area, and I'd say 100, people came. It was a HIMSS conference, or it was a conference to talk about trying to, move HIMSS into the states. Um, Most of the HIMSS activity that I was involved in before was going to national conferences,
Hmm.
and I think that was true of many people. And for some reason, that despite their best efforts, Bill and his team, it didn't quite catch. I guess the time wasn't quite right. And then a group of telecommunications people took it over and decided to go in a different direction, kind of a focused, a narrower scope. And HIMSS was developing guidelines nationally for the chapters, and whoever the leaders were at that time, they didn't want to go along with it. And so they were decertified.
Mm.
And you know, a bunch of us kept thinking, we really ought to bring the conference to Michigan. I mean, we need speakers here. We've got a lot of people who could contribute. It would be great, but kind of takes a focused effort. So in December of 2000, I got an email from uh, a woman at HIMSS who was charged with trying to get interest in the chapter. I think it went out to 6 people, but I was the only one who responded. And I talked my leadership into being supportive. That at the time that was Covance's. I worked for Henry Ford, but Covance's had the executive and all the systems side of the business. So I was at Henry Ford, um, and I thought, I have friends all over the place from all these other
Yeah.
activities, national friends. Let's do it. Let's start this up here. We have a lot to offer. We could do things here and then take them to national. We could get people involved in national activities, because I was already involved in some committees and stuff. So I thought, okay, great. So we got a conversation going, and there were a couple of people who wanted to have multiple HIMSS chapters in the state, for each region. But we decided that it should be statewide, and we would make sure we had representation in every region. And, I twisted the arms of all my friends. And and we had stakeholders from many nonprofits and a lot of hospitals, both in Detroit and around the state. We had representation from the Upper Peninsula, from the East, from Lansing, from Grand Rapids. Got our charter approved in April of 2002, and a month later, we put on our first conference. And mind you,
Wow,
we didn't have a lot. We didn't have a lot of money, but we did have a lot of people who helped sponsor us.
that's
And we had
incredible. 1
130.
month?
Yeah, yeah. Well, we had been leading up to it,
Yeah.
but a month after the official charter. So, and we were lucky too because we had HIMSS leaders who lived in Ann Arbor and Detroit, from national who came to help us out. But we had 130 people attend, and it was a big success. So we had to build on that. So we built a bunch of committees, and we got going. And then,
That is
yeah, it was fun.
130. Wow. And the first one, gosh, that is quite an accomplishment. I'm sure any chapter, that's formed recently would love to have those kind of numbers for their first conference. That's terrific.
Well, it tells you there was an appetite in the
Yeah.
state for this, and
And
it fit in with all the other stuff that was going on with health information exchange and the national movement to automate, and and it was a great time.
well, as someone that's on the western side of the state, I appreciate the fact that you made the commitment for this to be a statewide. I know a number of chapters, tend to focus on a particular metro area or section of a state, and we're really fortunate, I think, to have all the different areas of the state with their own, some somewhat unique challenges depending on where they're located. Although we tend to find we have more in common than not. Helen, you've seen, and as you mentioned, we've got a number of committees now. We've got engagement throughout the state. We've got, people like Jeff and others that are, continuing to be added on to the board and the membership and getting active, which is fantastic. What would you like to see the chapter do in the next 3 to 5 years? We've had a 4-year run so far. So
Mhm.
looking at 3 to 5 years, what would you like to see, either growth or changed or added on to what's already happening today?
Well, I think we've been very fortunate to have great leadership from people and very wide support from nonprofits throughout the state and from the state itself. Collaboration with MIHIN. We have really a great network and a great safety net in case somebody has a career challenge. So we have people who can step up. But
Hmm.
and we've been working the last few years on making sure that we get people right in college and right out of college involved here in our chapter. One example is Rutendo Goto, who's currently our professional development chair, but 5 years ago was working on her degree and was an intern on a MyHive project, which was an e-lab project that we collaborated with U of M and other universities on. And so, she graduated, she got to go to national conferences, she spoke to people, she's now, I think, got her PhD, and she's well established. We have a number of members. C. Crittenton is another example, who started out as a MIHIN intern and a student and is now has a job at MIHIN and comes spend to 4 or 5 of the national conferences and
Hmm.
helps out with advocacy, the advocacy committee, which is my pet project, advocacy and public policy. But I see our initiative with the University of Michigan with the Health Informatics Student Organization, School of Public Health, and with the health, the group, the HILSS group that's in both the med school and the School of Information, and with other schools and colleges, Michigan Tech, and Saginaw Valley, and colleges all over the state, as a place to help educate and get people prepared for their careers, and to give them some mentors and to bring new life to the chapter. And I think the more we do that, the better off we'll be. But I think we also have to keep our focus on what's happening nationally. I would love to see more people involved in global HIMSS committees. There's the Public Policy Committee, the Chapter Advocacy Committee. Crystal Schramm, who's our tribal liaison, and a couple of us started to work with National several years ago, and now we have Native American and Indigenous health going across all the states, working with Robert Coffey in Oklahoma, Tom Leary and Hal Wolf, helping to really support it at HIMSS Global. We have lots of areas where we can continue to grow, but having had lots of roles at HIMSS National, chairing interoperability and standards, and we're representing them on the Cantera initiative, and a number of quality groups and others. There are fantastic opportunities there to contribute, but also to network and to grow in understanding, and to contribute to them what we've done here. So takes a. It's trite to say it takes a village, but it takes multiple villages to make this work.
I really appreciate you adding those areas of your involvement with HIMSS Global and encouraging others in our chapter. I think what you said about getting the students involved earlier is something that we really appreciate, you encouraging that. And I know, just as a teaser, the chapter is looking to build on that and introduce a mentoring program, soon, to kind of build on that type of work. In addition to the committees that you've been on and your engagement with HIMSS Global for quite a long period of time, you earned your FHIMSS fellowship along the way. So for people in the room who are thinking about pursuing that or don't know what it is, what does that mean to you? Why did you get it? And what has it meant to you once you getting that?
Well, you can be a member of HIMSS and a member of committees and not go for a fellow, but I would say that it's enriching. You have to have spoken and led projects, and you need a good network of people who recommend you, but it brings you into contact with the board of HIMSS, the international board, with other fellows, and it represents a career achievement. And it's good for the chapter to have fellows. Donna Roach, who was one of our presidents here in Michigan a number of years ago, and then moved on and is now leading at the University of Utah, is now on one of our global HIMSS boards, and she's a fellow. And, Dr. Mike Sarukian, who's the chair of the HIT Commission, is a fellow. He was chair of the North America board. You get opportunities when you're a fellow to meet people from the international community. I got a chance a couple of years ago to sit down with people who are forming communities, which are the European equivalent of chapters, and talk to them, Finland and Italy and Germany. And I don't know, just get it's a great group. And one other perk is that at the conferences, you get to sit in the center in a couple of the first rows along with the board.
That's
So
great. Well,
great. And Lee, Lee Marana, who's co-chair of the HIT Commission, I see he's on and he needs to get his FHIMSS.
see, that's Helen. She's always prodding us to do more. We love
You
it.
guys too, come on.
Well, I've got I got a long way to go before I'm going to be qualified for that, but thank you, Helen. So speaking of this year's event, you just received the 2026 HIMSS Changemaker Founders Award for Lifetime Achievement in Healthcare Advocacy at the event. I can't share with our audience how excited and proud all of us were for Helen and for our chapter. But Helen, thinking about it, what was going through your mind when you found out you had received this award?
Well, I was A, stunned, and B, deeply honored and touched. You can hear it in my voice, but it's really a tribute to everybody that I've worked with over the years. People at HIMSS, people in our chapter, people throughout the state, wonderful people who've helped me, have mentored me, have helped me mentor them, have joined projects, helped make a difference. And that recognition was pretty stunning. I mean, I really was very deeply touched.
Well, if anybody realized how many, and I'm sure the people that gave you the award do, the amount of issues, events, and opportunities for advocacy, both locally and nationally, that you and your stellar committee of Michigan HIMSS keep track of, it's absolutely amazing. Every board meeting that we meet, I look through all of that. I'm like, how does she keep track of all of this on top of everything else she's involved with? It's really, really amazing.
Well, thank you. But we have great support from HIMSS Government Relations too, from Tom Leary and Alana Lehrer and Jonathan French, Alana, and Valerie Rogers, and a whole host of people who came before them. And they keep us up to date on what's happening federally. And in the old days, we used to go to the Hill and we met with uh, committees of Congress, and I met in senators' offices and representatives and got to testify. And uh, we took about 90 people in 2009. We had a Michigan Day on Capitol Hill and took people there to talk to federal agency heads and try to bring some development money back to the state. And we, in our audience, we had the president of Michigan State University and of their med school. In addition to people in industry and colleges. It was a great time.
Yeah.
It's I think that we can make such a difference, and it was getting this award was amazing, and being up on the stage with other change makers, with the Lieutenant Governor of Colorado and Dr. Hannah Galvin, who's doing quality work, and meeting with my friend Susie Hull, who's got the nursing informatics change maker, and just people from all over, and then getting all the thanks from all the comments and plaudits from people all over the place who really are the people who helped me was touching.
Well, that's great. And that's wonderful. Um, that's a wonderful accomplishment, and it's great to see the recognition because of the number of people and organizations that you've helped. You mentioned, going to Washington, D.C. Helen, do you spend a lot of time in Lansing these days, or members of your advocacy committee? Is that something that, is a critical part?
Well, we have some members who are up in Lansing advocating, for instance, for health data utilities. they tend to be doing it on the part of their organization. So the medical society has people there all the time. We keep in contact with the legislature, and we support HIMSS initiatives, national and in the state. Late since the pandemic, it's been harder to go up there.
Yeah.
I mean, people aren't there often, and but we would like to see that change and get more involvement. But we do have great contacts with the state of Michigan, with the Michigan Department of Health and Human Services, and with the Health IT Commission, which is a 13-member commission appointed by the governor. And as I said before, chaired by Dr. Zarukian and Lee Marana. And on our board, we have some past chairs of the commission, Pat Reinvelt for one, and on the and MIHIN is very active in the MIHIN board in supporting those things. So we have, people who've been involved in health information across the state, but we do have a plan to, to increase our focus there. We're also partnering with other organizations like MHIMA through Michigan.
Yep.
So that, and we want to do that. We're going to develop that relationship. We have a relationship with the medical society through Dara Barrera and others, and we want to expand that and get the nursing organizations and others involved. But I think we have great opportunities to collaborate. I mean, one thing that's happening the first week in May is that HIMSS, AHIMA, and CHIME are all advocating for patient ID now, a way to simplify. Yeah. We have legislative complications that date back to, I think, 1999. And there's one senator who consistently refuses to allow it to go through and on a continuing resolution. But it's a critical problem for the industry, and it's something that we want to support here. So we'll be working with them to support that initiative.
That's great. Okay, I've got one more question, and then we're going to open it up for audience questions. So if you could change one thing about how Michigan approaches healthcare information technology over the next 5 years, would it be a policy, one behavior, one investment? What would it be? Wave that magic wand.
Well, we definitely need more investment. And I think that the commission is on the right track. We have a roadmap, and we're following a path to get more consistency across the state. But we're going to need guidelines for AI, for instance. That's on track for us. But really, we invest very little right now in health information exchange, and it's really critical. And we have a lot of national initiatives going on with, qualified health information exchanges, QHINs, and something called TEFCA that some of our members will know well and others don't need to know. But it's basically an attempt to exchange data across the nation. But we need to address the needs of our population and cover all of the state. We have areas of the state that really are underserved, and we need to provide both technology and computer services to them, and training and education, so that we can really truly exchange high quality data. And I guess if I had one thing that we could focus on, it would be trying to get a statewide initiative to improve the quality of the data that we have. I mean, as you can, it's always been a problem. It was a problem when I started. It's a bigger problem now because there's more data being exchanged, but
that's a great point.
We need to rely on high quality data in order to deliver high quality care.
Wonderful. All right, Jeff.
Sorry, we are at just about the 15-minute mark, and we have a question in the chat. And Helen, you mentioned funding the health information exchanges, so that's a good
Mhm.
segue into this question from Tuan. Tuan, what is the underlying technology powering Michigan's health information exchanges? Who's supporting it operationally? And how is it funded?
Oh, that's a complex question.
It's a
So,
four-part question, so yes, pick one.
all right. So I think I said that initially when we all started, we didn't have common infrastructure. We had to build it. And
Hmm.
a lot of the stuff was like science projects. And then we had to try to interconnect it and develop some standards for exchange, both within a state and across states, and then nationally, and at some point in the future, internationally. But here in Michigan, MIHIN has a number of MIHIN is the state um, health information exchange, and then it has many customers. There are payers and provider organizations and hospitals and quality organizations. I think they do some work with the prisons, with behavioral health networks. So there are some products that they've developed, but a lot of products that they now have integrated. And, I don't want to go into I'm sure I would miss something if I started with a list of what they're doing, but I would have you get in touch with either Jackie Porter, who is the chief operating officer of MIHIN, or um, Isabel Pacheco, who's the chief executive officer, who can give you a briefing on that. And I think MIHIN on its website has a lot of information about the technology that it's using. Um, yeah, like anything else, it's complicated. Funding comes from some of this funding comes from the state buys services from MIHIN for defined products and projects. The payers fund some initiatives, some for physician organizations and some for their own internal quality and risk management. We get some grants, a lot of sources of funding. Did I touch? It was complicated. So what
I
else?
think I think you got I think you got all three or four of the elements of it.
Uh,
I
but
imagine the
we're
underlying
looking
technologies
for.
evolved quite a bit in the 20 years
Oh,
from the advance of cloud computing, AI, mobile, bring your own devices.
oh,
It's changed a
sure,
lot since the
sure,
chapter was founded in
sure. Yeah,
2002.
yeah. And MIHIN uses Cloudticity, AWS for its clouds, and Smile, and other. I don't want to leave out vendors, but they do some of their own stuff, but much less than they did in the past in development. Now they put together products and services, and you know and help in that way. But that's true, I think, nationally as well. Um,
Any other questions from the participants? Please share in the chat. Thank you, Isabel, for that offer to follow up. I think we've got some interest here, so look forward
Helen,
to connecting you with Tuan.
I had a question related
mhm.
to this. You mentioned earlier areas of the state that are underserved by health information exchanges. Can you mind sharing where those might be?
Well, they can be rural or urban. Uh, they're in all areas of the state. But a lot of the rural communities, the state has had initiatives to extend broadband and other technologies. They've had funding from the feds. It's decreasing now, but to try to connect people. But
Hmm.
connecting isn't the only answer. So small health systems, community information networks. There's a community information network initiative that's going on in the state to share social needs. There are lots of small providers. There are specialists, dentists, and others who could benefit from connections. But if you're talking, a large rural poor area, there are a lot of people who don't have the money for the technology to connect. And individual access is now a priority in health information exchange. Just starting, but we may be able to connect to the bigger systems, and through groups like Blue Cross to POs, physician organizations, and independent physicians across the state. But there are areas that are not served.
So the work's not done.
Not done. Lots of opportunity. And, you could look at educate during the Flint lead crisis. We had a couple of seminars and invited the coordinator for the ONC to come and speak, and a bunch of agency heads. And we got specialists from across the state talking about where the gaps were, and what was preventing people from exchanging the data that was necessary to treat, identify and treat and follow the children who were affected by the lead in the water in Flint. And the number of gaps was amazing. And it's not just technology, it's policy as well. So a teacher might not have access, might not have permission to access the health records or indicators of a student. So might not know that this was a student who was affected by lead in the water. and providing extra remedial help. So lots of issues, but that was an exciting time too.
I can imagine.
Good and bad.
Yeah. And it highlighted the need for this kind of an information exchange for sure.
Yep. So, I think that the Michigan HIMSS has been a leader in trying to pull people together for conferences, for projects. And I'd like to see the chapter continue to do that, to bring in more of the diverse players. Although, we are pretty diverse, there are areas where we could definitely improve, keep being a gold chapter, keep being an advocacy, public policy change maker. Lots of things we can do. So,
and you will keep us on task, I'm sure, for sure.
You guys you're wonderful, all of you, and people in the audience, my friends, just absolutely wonderful.
Fantastic. Jeff, anything you want to add as we get close to wrapping up?
Well, there's a few other comments in the chat, but just some positive feedback and kudos and gratitude for Helen, and wanted to just thank everyone again for joining today. I'm really excited about the road ahead for 2026, some of the events we have coming up. I shared a link to our next regional networking event, which will be April 30th at Fleming's Prime Steakhouse in collaboration with C3 Technology Advisors. Also, save the date, announcement coming soon. We have our next HIMSS Michigan Summer Golf Outing on June 22nd in Grand Rapids at the Indian Trails Golf Course. So that announcement will be coming out in the next week or so. And really excited to continue engaging with our members here, our partners, our community partners and sponsors. So thank you all for showing up today, and we appreciate you. Thank you, Helen and Art, for sharing your time with us. And this concludes our webinar.
Thank you so much for the opportunity.
Thank you.
Thanks, Helen.
Take care.
Bye, everyone.